Listen. I called the human resource person. I said, your lady doesn't seem like there's a big mechanism. Doesn't seem like she has much exam. But here's what she said. When I asked her, she's going to make work. Give me a big 0, right? I don't understand that, right? Because, well, I don't know. I'll try to check out see if something going on in the work environment. I get a call a few weeks later. This is a true story. True story. Ready? It turned out that the head of housekeeping, her boss, and the assistant head of housekeeping were part of a minority mafia. And they were extracting payments from all the workers to support them. They fired these guys, and then guess what? Her shoulder got better, right? True story. Just let you know what you can pick up sometimes, right? When you have these perceived stresses, there's scales for that. And there's ways to look at that where you can ask them questions about things like this, which can be on a 4-point scale, which is something that maybe you like that better, right? So it's another way you can do that, right? There's a professional scale, quality of life scale, right? Where you can look at different things that are making you happy. By the way, this is a lot of stuff that's going on to us. Look at this. Look. This is the professional quality of life scale, right? So this has to do, and something that's been applied to a lot of us, right? Where it takes a look at physicians, healthcare providers, frontline workers, right? You hear a lot about that stuff right now, about the stresses of having gone through some of the things we've been going through, right? Or just the nature of our careers, right? There's questionnaires you could do that. If you're seeing somebody that fits into a more professional capacity, you can give them this questionnaire, right? And document, what are they thinking? Are they having stress issues operating? Is that determining what they're seeing you for? Because remember, I told you, a lot of these people come not saying I'm stressed or depressed or anxious, but saying my back hurts, my arm hurts, my shoulder hurts, my leg hurts, right? You need to know these things are operating, right? Don't treat them like everybody else, right? Professional quality of life is based on a lot of things, right? It's based on a lot of our impacts with each other, based on the impacts from the different environments, what that can do, and can it lead to compassion, fatigue? Can it lead to exhaustion? Can it lead to depress work environment, right? These are the things that could be operating, right? There's concept of social capital, right? Where how good are we at bonding, bridging, linking, and between different teams, right? When social capital is possible, this leads to a great work environment. When you're getting along well with people, when you are in an environment where everybody supports each other, when you have that, we are social animals. By the way, this comes out a lot of times when we talk about, people working at home, right? There's a lot of stuff, a lot of literature about, how many people like to work at home, like having some control of that, but there's a lot of people, majority, who want to work in a work environment and see other people at least a few days a week. We are social animals. The social capital is important to us. It makes a difference. If they're not happy at their job, they're not going back to work. The determinant of their going back to work has to do with these different domains. And it has to do when it's positive, you're in a good place, right? It has to do with those measures, right? If somebody's not happy at work, they're not going back, right? You've got to know, is this operating, right? Give them a questionnaire, ask them that stuff. Okay, next. Mick Sullivan. Mick Sullivan has some questions. So I've taken a couple of his most discriminating questions, right? This is called the pain catastrophizing score, the PCS, right? When I'm in pain, I worry all the time about whether the pain will end, right? And he gives a scale of 0 to 4, right? Next, the injustice experiences questionnaire, right? Nothing will ever make up for all that I've gone through, right? So what that means is that they're now reporting to you these certain areas of feelings of injustice, right? So they're catastrophizing. And so when people start catastrophizing, they're not getting back to work. They're not going to go and through the normal process. They're not going to report to you the same way. If they feel that this is injustice, right? That this has been a travesty, that the employer should have known. You represent the employer should know. You as a doctor should know, right? And they have a feeling of injustice, then if that's their belief system, they're not going to get better, right? Give them a questionnaire. Ask these questions, right? So, for example, These difficulties can be seen in many papers. This has been described many times. Let me just show you one. Look. This is patient 25 who was a sedentary employee who developed back pain one day sitting at work. Okay, now look. Can people sitting in a chair develop back pain? Yes. Is that the most common mechanism of injury that all of a sudden they have severe back pain from sitting in a chair and then all of a sudden they have scales of 4 on these questions? No chance, right? That's not what's operating here. The pain is not in their spine. There's something about the work environment. There's something about them. There's something about their belief systems. There's something about their illness behavior. There's something about their personality. Something is operating. Give them a questionnaire. Document it. It'll support your opinion. It'll let you know what you're operating with. It'll give you that latitude to be certain about what you're dealing with and why you are or are not recommending certain approaches, right? Now, final psychometrics. If you do somebody with back pain, I like the modified role Morse questionnaire. If you do neck pain, I like the Vertebral neck dysfunction. So I pack these onto the back of my pain questionnaires. So here's the back questionnaire. Now here's our CNA, right? 23 out of 23 positive, right? This problem is not in the spine. This problem is in their mind, okay? Take a look. Here's another one. Look at this. Look at this. This is the book seller from a well-known company. Look at this. She adds a question to the questionnaire. 23 are not enough. I'm going to give you 24. I'm going to change the questionnaire. I'm going to change the literature. They don't know what they're talking about. I am severe, right? And there's only one time where she says, okay, no, right? When you see this, this is somatization, symptomification, delayed recovery, chronicity of illness, the DSM-5 criteria of somatic symptom disorders. This is the conversions. This is the borderlines. This is some of the passive aggressive. You can have everything operating here, right? You need to know about it, right? You need to document it. Give them a questionnaire. Have it in your chart. Know what you're relying on when you justify your opinion, right? Look here. Look. This is the Vertebral neck disability, which I give to people, right? So you can start seeing. Look at this. So it goes, remember it goes 0, 1, 2, 3, 4, 5, right? So 5, 4, 5. Okay, reading, no, don't have problems. 3, right? You start adding these up, you see, oh my gosh, look at this. Everything's so high, right? Look at this. Look. Here's the long-term disability one with both hypothyroid and hyperthyroid. I told you about this lady. Look at her marks, right? Look at this. 4, 5, 4, 5. It's very high. This is not normal. When you have people with this much reporting, it documents what's going on, right? It protects you. It substantiates your opinion. Okay, arrest stop, right? So I want to remind you, because we've been doing a lot. There's a lot of information here, but I'm trying to help you. I'm trying to help protect you and you're reporting your practice. Okay, so a couple things. One, we've talked about the questionnaires. Why do questionnaires? What could be operating? What are some of the general questionnaires and the clues on that history? The job work history. Any of the review systems, all that kind of stuff. Right? Very important. Right? We talked about the pain questionnaires, looking for those patterns. We talked about the personality types. Right? I'm not done, right? I want to show you some more stuff, right? Stay with me on this. Look, an exit questionnaire, okay? This is a questionnaire I give to all the patients when they leave my office, right? You might want to consider doing this also, right? Look at those questions, right? The office personnel were courteous, considerate, explained the exam was thorough. The examination and testing did not harm me. Do you see that question in there? You know why I put that question there. Because have you ever had somebody that comes back and says something you did hurt them? I do this at the time of their exit. I have them fill it out, right? And by the way, I had a lawyer come to take my deposition. The lawyer says, they didn't like my opinion, right? The lawyer comes in, first question, Dr. Hyman, my client says that the process of your examination injured them greatly. And they were greatly distressed by the pain and injury that they went through your office. I pulled out this questionnaire. I showed it to him that there was no indication at all. Depo over, right? Stopped it right there, said, oh, thank you for your time, left. Got it? This helps protect you. Look, even when I showed you all the questionnaires I'm suggesting, all the questionnaires I recommend, right? All the ways to try to evaluate patients, right? I give them this exit questionnaire. Look at this. This is patient SB. This is his 6th workers' compensation claim. I was asked, and I said at the very beginning, you were sent here today to talk about your inguinal hernia. That's all you were sent here for, right? Here we go. Here's the exit questionnaire. 5, everything's great, great, great. But I was told at one time that an eczema and psoriasis on my skin, and here's the word over, right? Now, we're not done, right? We're not done. Just like some of the other ones, they got to write this on the back. This is an exit questionnaire. They're already leaving my office. I've already done the history, done the exam, any laboratory testing, right? And they're not done. Their illness is their life. They want the attention, right? They want you to understand what they're in. You start seeing those multiple claims, multiple doctors, that's an indication that someone's got somatization, symptom modification, delayed recovery, chronicity of illness. Don't treat them the way you treat anybody else. They're not going to get better. That's not who they are, right? Right. Now, what I've shown you up till now is all these different questionnaires, right? And one of the things that is operating here is coherence analysis. Okay, what does that mean, right? What does that mean? So it means that you see all the C's that I like to call, right? Which is where between all these different questionnaires, you're going to see the same types of patterns. You're going to see the same types of responses. It's going to flow through. So the advantage to you is that it gives you a broad base upon which to defend yourself, support your opinion, protect yourself, justify your decisions, right? Because you're going to have this broad base of information, right? So look. You've got all these things operating here, which can influence the result. But most importantly, you're going to see it go through these things. Okay, so here, I'm going to show you an example. Ready? Stay with me. Stay with me. This is very important. Watch. Here, we're going to go through one patient, like all their stuff all at once. Go watch this. Watch. Okay? Patient you, 37-year-old deli clerk, worked at a local supermarket. Initially, she was slipping, fall on the ground. Okay, so she's in the deli. She falls on her butt. That's it. That's all we got. Ready? Here we go. Okay, so everything makes her worse. Kind of difficult on the side to see it, but she's checked off everything in the middle. Here's the pain diagram. So it looks like the Texas Chainsaw Massacre from Texas, right? It's crazy, right? Here's the anxiety, depression, fear, avoidance, belief, right? Here's love my job. Look. Circles, not all certain, not even on the scale, right? Here's the modified Roland-Morris questionnaire. Here's the Vernier neck dysmetrics, right? You see it again and again. It flows through that coherence analysis where you see the continuity of everything flowing through the different questionnaires, right? You see that pattern. So somebody can't come and say, well, you just gave him a Vernier neck dysmetrics. Is that the only thing that's out there? No, right? I did the FABQ, I did the Vermont, I did the APGAR, I did the modified Roland-Morris, I did the California pain diagrams, right? So this starts to substantiate your report. It looks like a credible report. It looks like substantial medical evidence. It's going to protect you in your decisions, right? It's going to help you justify your ratings, right? Okay, look at this, right? Here's another one. Stay with me, okay? 46-year-old woman who was pushing a tray of food, slipped and fell forward. It was only soft tissue injured. Her exam had frequent exhaling, grimacing when I did the otoscope in her ears, abdominal tenderness that disappeared when I used the stethoscope. So in other words, I put my hands there, oh. I said, oh, good, I'm going to listen to your abdomen. I put the stethoscope, I could mash all the way down the kidney. She didn't move, right? These are non-physiologic findings, right? Let's take a look at our questionnaires, okay? Well, here we go. First, sorry. Here you go. Look. Right side, left side. Look, you got all the different nerve endings going on, right? It's constant. It's severe. I have constant numbness, right? Everything makes me worse, right? Let's take a look at the pain diagrams. Okay, here we go. California out-of-body experience, right? Everything's going on, right? Let's take a look. How certain are you going to be back at work? 0. And look at those Sullivan questions, right? All the time. I think about this all the time. I know I'm not going to get better, right? That's the pattern. Let's look at your modified Roland-Morris questionnaire, right? Let's look at the Vernier neck dysmetrics. See it? Look at those numbers. See, 4, 5, 4, 5, right? Okay. So look, now I've shown you a couple of these things. I've shown you them in detail. You're starting to see the pattern. You're starting to see what happens, right? So I'm going to show you somebody else. I'm not going to tell you anything about them, right? I want you to look at these things very carefully because you're starting to go. I'm starting to get you. I'm getting you from system 2 to system 1, where you and I, who are trained in medicine, and we know how to recognize patterns, we're now learning to recognize these patterns on paper, to document things, right? So let's take a look, okay? So here we go. I'm gonna give you some time. Okay, here we go. Ready? Ready? Okay. Take a look, right? So you see, here's the descriptions. Okay, frequent, slight. Here's some things make better, some things worse, no effect, right? Got it? See the pattern? Okay, do the next one. Here's the California pain diagram. Got it? So you see this over here, a little over here, this, got it? Okay, continuing. Your pain right now, 40. Average pain, 50. We're 65. Anxiety, depression, health loss to control, fear, avoidance, belief at about a 6, right? Here's the modified Roll-Morris questionnaire, right? So maybe half and half, right? Fair? Now, I'm showing this example so you can see that pattern. And also you're saying, well, geez, Mark, you showed me these other examples. Everything's so severe, so there. This one doesn't look as bad, right? So you start thinking, well, maybe that's a little more credible. But who was this patient? This patient played for the wide receiver in the NFL for 13 years. That's what normal looks like, right? A wide receiver in the NFL. Do you know the forces that these people go through and the pounding their bodies take, right? That's why it's so extreme, so severe, so difficult, right? And yet, this is normal responses, right? So it gives you an idea. These questionnaires work, right? They help guide you, okay? All right, we're encouraging people to become involved in their own rescue. I've told you about this, really important. You got to get people taking care of themselves. You got to get them from that external locus of control to internal locus of control, right? It is much more important to know what sort of patient has a disease than what sort of disease the patient has. That's Osler, 1600, right? Maimonides. Just as body humors influence man's virtues, so too do virtues influence their humors. If that doesn't go back far enough for you, Aristotle, the treatment of the part should never be undertaken without considering a whole person. That's the era of our day. Look at that, our day, right? Aristotle, our day, right? Right? Hyman says, not Simon said, treatment of treatment of mind in all cultures, rituals important. We talked about the importance of culture. We talked about the importance of social capital and all those kind of things. And that's it. Okay, so these are the boys. And I'm going to exit out of the slideshow just so that I can give a whole human being here. And then this is the time where you and I can open this up for questions, right? And so what I want to do is I want to get first of all, there's one thing in the chat, but feel free. Good news about these. Good news about the breakout sessions. They're very small, so we can get to big people. So we've talked about the questionnaires. We've talked about the importance of having this documentation for yourselves. We've talked about how this can be important for you and how it can help you in understanding what you need to think about, what you need to consider, how you have to incorporate this into your reporting to substantiate your opinion, to protect yourself so that you can hopefully do well. So I'm open for questions from everybody. I know it's a lot of material, but I'm happy to take questions if anybody has any for everything that we covered today. We good? Yes? Okay. Fantastic. All right. I hope this was helpful for you. I hope that you got something that you could really use in your practice. And that if you have any questions about the questionnaires, about what they mean or how they apply, you can certainly always contact me, and it'll help you in what you're trying to do with the patient. I wish you all the very best. Everybody should have good health, and let me know if you need anything. Thanks so much.
All right, I'm going to stop recording.